I'm Dr. Casey and welcome back to my YouTube channel. Today I'm going to be going over my go-tos for any low back pain. So if you're experiencing low back tightness issues, soreness after a workout, these are my go-tos. Before we get started, please subscribe to my channel, like this video, and push that notification bell to be reminded of future videos. Let's get started. I am going to show you the top stretch that I tell everyone that everyone does, everyone loves, everyone's been following me on Instagram because of this amazing stretch. This stretch is going to stretch your piriformis muscle. It's that right in the center butt muscle, okay? I call this the figure 4 stretch. So what you want to do is you want to sit closer to the edge of the chair or table or wherever you're at. This is a seated version. There's so many ways to do this, but I'm going to show you first how to do it seated. Cross your leg over. Make sure that this part of the ankle is touching the thigh so that your foot's hanging off. So it's the ankle that's supported. Same side leg where the ankle is, you're gonna support that with the left hand, and then I'm gonna push down on my thigh with my right. So if this feels comfortable and your shoulders are not all wonky, then you stay here. And if you feel that stretch here, stay here. If you feel that you're not getting enough of a stretch and you want more of a stretch because you're a little bit more mobile, then you're gonna bend at the waist. So you're reaching forward with your chest. So you keep that spine neutral, and I'm gonna show you from this side. Sometimes some of my patients, this position, they start to hike their trap up to their ear or their shoulder up to their ear. So another way to prevent that is to put your forearm down on your thigh, and that's going to help you keep this locked in so your shoulder is not coming up to your ear, and you'll get a better stretch this way as well. You want to hold these static stretches for about 30 seconds to a minute, probably 3 times a day. So hold. Then what do? We always do the other side. So again, support that ankle with the right hand, push down on your left thigh with your left hand, and you reach forward with your chest. And I'll show you from the side. Again, if you need that variation, use your forearm here. Again, this is 30 seconds to about a minute, 3 times a day. Then to add on to that, if you feel like you're ready to, you cross your leg over. This is going to help get mobility in the thoracic spine. So you're keeping your lumbar spine neutral. You're going to cross this arm over, open your hand up like you're serving a plate of whatever you like to eat, and you're going to look with your eyes over your shoulder. And you'll feel that opening up in the chest. And again, I always do the other side. So you cross that leg over, relax that opposite arm over, and then look over with your eyes. Again, hold that plate out. And then hold again, 30 seconds to a minute, about 3 times a day. This is my next go-to low back stretch. This is great for getting the piriformis muscle again, that external rotator of your hip, if you are lying down in bed or lying on the floor, and if you're not sitting. So just a different variation. It's called thread the needle. It's great, again, for that piriformis external rotator of your hip. You want to lie flat on the floor, back flat. Again, you can always use a pillow to support your head, and you're going to cross that leg over. You're going to bend one knee and then cross that leg over. And then you're going to pull through this leg and lift up. To get more of a stretch, you're going to push that knee out by keeping this foot flexed and using this elbow to drive that thigh out. And you're going to pull in. Keeping your feet flexed actually creates more of a stretch. Again, hold this for about 30 to 60 seconds. Always do both sides. You will notice that you're tighter on one side than the other. Totally normal. Again, we all have imbalances, just working on them and making sure that we're functioning optimally. For me, I'm a little bit more tight on my right side, so I can feel my knee kind of caving and dropping in. So I really have to think about forcing that knee, pushing out. Next, I always go to my knee to chest stretch. Amazing for low back issues. You're gonna hug one knee into your chest, keep that leg flat, and make sure your back is flat. If your back starts to come off the floor when your leg is straight, then bend the other knee. You'll still get the benefit of that tractioning of the low back. Again, hold for 30 to 60 seconds. Make sure your shoulders aren't coming up to your ears either. You want to keep that locked in. Everything should be working. And then you're going to switch to the other side. And then you're going to do both knees at the same time. These are great for tractioning and opening up the low back, especially if you're having any low back tightness. The next stretch that I love for low back issues is child's pose. You're gonna make sure your butt's to your heels and you're gonna reach forward, keeping again a neutral spine. You can do the child's pose with knees together, or for a different variation, you can open your knees up and then stretch forward. This is another way to open up the hips a little bit more, is by doing child's pose with knees wider. I just showed you my go-to low back stretches when my patients have low back tightness or any low back issues. I went over the figure 4 stretch, which helps with your piriformis, external rotator of your hip. I showed you different variations of that, as long as with the twist, which helps open up the thoracic spine, the mid-back. Then we went over child's pose and knee to chest. All are amazing to help create more mobility in your hip. It may not seem that we did specific low back stretches. However, opening up the hips are the key to taking pressure off the low back, because our hips compensate for our low back. A lot of our hip muscles attach to the lumbar spine. So that's why I always focus on creating more mobility there, which will help decrease that low back issue. And then you can start strengthening from there. Don't forget to subscribe to my channel, like this video because it's amazing, and press that notification bell to get reminded of future videos. Move well first, then move often. Thanks for watching.